that. Paper is blank. Quick little 360 of the room. All right, let's begin the fun. Knock, knock. When I shut the door to provide some privacy. Hello, sir. Could you please tell me your name and date of birth?
David Jensen, June 27, 2000.
Perfect. May I see a wristband to confirm that? Awesome. Mr. Jensen, do you have any allergies that I should be aware of?
No.
Alright, perfect. We're going to be performing a head-to-toe assessment. Are you familiar or have any questions about what that is?
No questions, and yeah, I'm familiar.
Alright, perfect. So first, I'm just going to ask you a few simple questions. Could you please tell me your name and not your name. Yeah, tell me your name actually.
David.
Again. Perfect. Mr. David, where are we right now? What type of building is this? What city are we in?
This is Alberno College in Mesa.
Perfect. And do you know what year it is, Mr. David?
It is 2025.
Perfect. Alright. So looking at my client's posture, everything right now, it seems he's in a kind of like a semi-Fowler's position. His mood, affect, and his facial features are appropriate for the situation. Do you use any mobility aids, Mr. Jensen?
No.
Alright. Do you have any IV tubes, any ostomies, drainage I should be aware of?
No.
Alright, so it seems that client's mobility is independent and he has no tubes or wires or patches or anything that will hinder that. And then are you in any pain right now?
No.
Perfect, no pain. Alright, so second to last thing I'm going to do is I'm going to take a full set of vitals. I do not have a temperature assessor, but if I did, I would take his oral temperature, put the probe right under the tongue, ask him to close his mouth, not to bite it, making sure that he hasn't eaten, drinking, smoked, or exercised in the last 30 minutes. I can, however, assess your respiratory rate and your pulse rate, so I'm going to ask for this hand, ask you to drape it over your stomach, just like that. Perfect. Just gonna get rocking and rolling. Nice strong +2 right here. Perfect. Got a pulse of 54 and a respiratory rate of 14. Alright. Fortunately, I do not have a pulse oximeter on me to check your oxygen levels, but I would check your nails to make sure that there's no fake nails or nail polish. Last thing we're gonna do is we're gonna do the blood pressure. I'm gonna do the two-step method. Do you have an arm of preference, sir, or have any surgeries, mastectomies, lymph node removals?
Nope.
Okay, perfect. You can begin the fun. You can lie your arm back down. Make sure your legs are not crossed. Right. Yeah. Boom. go. I lost your pulse around 120 millimeters of mercury, so we are going to pump it to 150. All right. While we're waiting for that, we can just continue on with the assessment for a little bit. I'm going to give you 3 words. They are going to be shirt, pencil, and flower. I'm going to ask these questions to you a little later on in the assessment. Perfect. So while we're waiting, give ourselves like 30 more seconds. I'm just going to kind of check your head area. Is it okay if I palpate your head? Alright, so I have performed hand hygiene before I got in the room. Any tenderness? Does that hurt at all?
No.
Alright, so it seems that his head is normal cephalic shape as I can see. It's non-tender. I don't see any lesions. I don't see any bumps or bruising. It seems that the hair distribution is normal. It is the same throughout. Is it okay if I touch your skin? So that. Yep. The skin is warm, skin is dry, skin is pink, and I don't see any involuntary facial movements or any infestations of the hair. Alright, on that note, it's been a full minute, so I'm gonna finish taking your blood pressure. Continue on to the neck. Okay, 122 over 58. Get that well. Alright, continuing on with the assessment of the head and neck. I'm going to, is it okay if I ask you to sit up a little bit?
Yep.
Alright, I'm going to come right behind you. I'm going to check your thyroid for any nodules or enlargements. And noted, could I ask you to give a nice swallow? Perfect. See that adamsalcular pharynx go up and down on phonation. And then it seems that his trachea is also midline. Sit back down if you'd like. Last thing I want to do is I would like to palpate all your lymph nodes. Just let me know if you feel any pain or tenderness at any point. Alright, so preauricular, got postauricular, got occipital, we have some maxillary, or submandibular, segmental, and tonsillar. Was there any pain on that?
No.
Alright, no enlargements noted. Lymph nodes were non-tender and non-palpable bilaterally. Okay, so we're gonna make our way over to the eye section. Since you're able to follow commands, sir, could I ask you to pull down your bottom eyelid on whichever eye you'd like?
Oh,
Without, sorry, yeah, not that. Perfect, I'm just gonna look. Alright, seems that his conjunctiva is pink. You can release now, sir. Sclera is white. There is no jaundice, there is no drainage noted, and I can tell that his eyes are symmetrical. Next, I am going to perform the pen light assessment to test for perla. So I'm gonna do is I'm gonna start the light on the side, and I'm just gonna really quickly shine it into your eyes. I should see that your pupils contract to make sure that your brain is working. Perfect. Other side. Perfect. Alright? So it seems that the pupils were equal, round, and reactive to light. Now I'm going to test convergence and accommodation. Put my finger out here. I'm going to move my finger closer into your nose. Alright. Just follow the tip of my finger. Perfect. One more time. Perfect. Pupils converge. Now what I'm going to have you do is, you see that black speaker back there?
Yep.
I'm going to ask you to look at it and then go back between my fingers. So could you look at my finger?
Mm-hmm.
Can you look at the black box up there? And then my finger again. And the black box up there. Perfect. So the pupils are equal, round, reactive to light. They are accommodating, and they are converging when appropriate to direct and consensual light. Can I also ask you to open your eyes? Perfect. Pupils are a normal size. They are 3 millimeters. So we are good to move on to the next section. We're going to move on to ear, nose, and throat. First, I'm going to check ears. Perfect. Go to the other side. Awesome. Now I'm just going to gently pinch your ears. Any pain on that?
No.
Alright. Seems that the ears are symmetrical. There is no tenderness. They have a normal amount of earwax, and there is no redness or lesions noted on the ears. Next, we're going to go to the nose. Perfect. And also inspect the outside of the nose. Alright. And then, sir, I'm going to ask you to take your right hand and plug your right nostril and take a nice deep breath through your nose. Perfect. Can I ask you the same with the left? Alright, perfect. Thank you. So it seems there's no redness, no lesions, no bumps noted. The septum is midline, and the nares are they're patent, which is what we love to see. No lesions or redness noted. Alright. Next, I'm just gonna check your sinuses. Just let me know if you feel any pain. Any pain? Alright. Up there.
No.
Okay, perfect. So our maxillary and frontal sinus, there is no tenderness or pain noted upon palpation. Which is great to hear. Alright, sir. Next, I'm gonna check your mouth. I'm gonna ask you to go with your tongue. Take your tongue out a little more, please. Perfect. Perfect. Alright, we love to see that. So it seems that the patient doesn't have any cavities, teeth are intact, he's not missing any. Oral mucosa is pink and moist. There's no white spots on the tongue, no lesions noted, and the tonsils are not red or inflamed. So now we are going to go to the respiratory system. Just looking at my patient so far, it seems that he is on room air. Doesn't seem to have any increased effort of breathing, no accessory muscles being used. Next what I'm going to do is I'm going to put my hands on your chest and your back to make sure that there is equal rise and fall on both sides. So, I just ask for a nice deep breath in. Perfect, and breathe out. Perfect. And then is it okay if I ask you to sit up, sir?
Yeah.
Can I sit up on the side of the bed? So I'm going to do your front and back lung sounds. Alright, and then one more deep breath in. Perfect. Now, perfect. So it seems that there is equal breathing on the right and left side. There is no lopsided breathing, whatever the official term for that is. Perfect. Now I'm going to assess your lung sounds. For the purpose of this video, I will be putting stethoscope to the clothing, but normally I would do this directly onto your skin. Perfect. That works. Equal chest rise and fall bilaterally. That's what I was looking for. Alright. Now you get a deep breath in. And out. Good. Breath in. Sorry, one more time. Good. Breath in. Now. Breath in. Now. Breath in. Perfect. Anterior side sounds good. All I hear is air whooshing. No adventitious lung sounds noted. I'm just gonna do a few spots on the back, all right? All right, deep breath in, please. Out. Nice. In. Out. Very nice. In. Out. One last spot. In and out. Perfect. That's really good. Lung sounds are normal. No adventitious sounds noted. Now we are going to make our way onto the cardiovascular system. May I please see your hand, sir? I'm going to check capillary refill time and make sure that it is less than 3 seconds. Making sure that there's no fake nails or gel nails. Check confirm with SpO2. Normally, I would also do the patient's feet, but I do not wish to expose the patient at this time. It seems that capillary refill was normal, less than 3 seconds bilaterally. Now I'm going to inspect the hands, make sure there is no clubbing. No clubbing noted bilaterally. I'm just gonna check for edema. Edema noted. Alright, perfect. No edema noted on the upper or lower extremities bilaterally. We're gonna make our way to your neck now. I'm gonna palpate your carotid artery one at a time because we don't want anything bad to happen. There we go. Just a little +2 on that side. Ooh, nice +2 on that side. Okay, so it seems that carotid arteries are +2 in strength bilaterally. Now I'm going to use the bell of my stethoscope. I'm going to listen for any bruise. Just be aware, sir, at one point I may ask you just to hold your breath just for a second. But you can breathe normally for now. Could I ask you just to hold your breath for a second? Perfect. You can breathe again. Perfect. No bruise noted bilaterally. Next, sir, I'm going to ask you to turn your head at a 45-degree angle. Pick whichever side you'd like. Perfect. No JVD noted. Could I ask you to turn your head to the other side? Perfect. No JVD noted. So next, I would like to assess the rest of your peripheral pulses. May I ask you to, you can rest your hands. I'm just gonna do this really quickly. Brachial. Brachial is +2. Radials are +2 bilaterally. Normally I would check the femoral pulse, but I'm not gonna do that to homie at this time. And check popliteal, pronounce it. Go. Popliteal is +2. So we're gonna go to posterior tibial. Posterior tibial is +2 bilaterally. And then we're gonna check dorsal pedialis. That's good, that's good. All right, +2. So all of Mr. Jensen's peripheral pulses are gonna be +2 in strength bilaterally. Last thing we're gonna do is we're going to go through all the cardiac landmarks. Just gonna check for normal S1 and S2. Hopefully no S3 and no S4. Alright. And kind of like the brewery assessment, I may at one point ask you to hold your breath just for a few seconds to get a cleaner look. Alright, so first I'm going to check the aortic, which is going to be second intercostal on the right sternal border. Perfect. Now I'm going to go to pulmonic, which is second intercostal left sternal border. Now down to Erb's point, left sternal border, third intercostal. Fourth intercostal, left sternal border is tricuspid. And last, we're going to go to the mitral valve, midclavicular, fifth intercostal. Perfect. S1 and S2 noted. Now I'm going to go through all those spots again with the bell of my stethoscope, checking for any sneaky S3 or S4s that we might hear. Alright, so we're just going to go the aortic. Pulmonic. Erb's point. Tricuspid. And mitral. Perfect. S1 and S2 noted. No murmurs, no adventitious heart sounds, no S3s, no S4s noted. Perfect. So now I want to go to the integumentary system. I'm going to test skin turgor. I can either do on the clavicle or the forearm. I'll do the patient's forearm for this. Perfect. So it seems the patient's skin rebounds, which means that their turgor is normal, no delay in it or anything like that, no signs of dehydration. For the purpose of this assessment, normally I would check all of the patient's skin, but for the purpose of this, I'm only going to assess the skin that is exposed. Just gonna glitter. All right, skin is warm, it's dry, it's pink. Don't see any redness, don't see any lesions, don't see any bumps or bruising. Don't see any discolorations, maybe a little bit right under that left eye. I know that homie does jiu-jitsu, so maybe that might be a little, might be normal. Yeah, no tattoos, no piercings noticed, no abnormalities of the integumentary skin noted. Next, we are going to go to musculoskeletal. So first, I'm just going to check that spine really quickly, checking for any kyphosis, any scoliosis, any pain. Hello, can you go? Any pain on that?
No.
Perfect. All right. Did not notice any scoliosis, did not notice any kyphosis. So we'd love to see that. Next, sir, what I'm going to ask you to do is I'm going to ask you to come over here to the side of the wall. I've already checked your mobility. That's good. Perfect. So over here, I'm going to ask you to walk. Let me get some of those environmental hazards out of the way. I'm just going to ask you to walk to the door, and then I'm going to ask you to turn around, and I'm going to ask you to do heel toe all the way back.
Okay.
Perfect. All right, and then I'm gonna ask you to come right over here. Before I ask you to sit back down, I'm gonna perform a Romberg test. I'm just gonna ask you to stay like that, and then can you close your eyes for me? Perfect. So that is a negative Romberg test. You can sit back down. So I noticed that his mobility is independent. He has good gait, and he has good balance. as also confirmed by the Romberg test. Next, I'm going to palpate your joints, checking for any swelling or tenderness. Just let me know if there's any, if you feel any of that, any hurties. Any pain on that?
No.
Perfect. So it seems that all of Mr. Jensen's joints are not swollen and they are non-tender bilaterally. Next, I'm going to test for range of motion. I just ask you to turn your head left and right, that atlantoaxial joint. Perfect, that's just a bonus, you don't need to. All right, now I'm gonna ask you like a jumping jack to raise your hands up. I'm gonna ask you to come about halfway down. And once you do some forward circles. Perfect, so backward circles. All right, next, I'm just gonna ask you to give me 1 or 2 bicep curls. Perfect, love the form. Next, we're gonna ask for flex your hands up. Yas Queen, go down. Then we're gonna do some inward circles, and we're gonna do some outward circles. Perfect. Can I ask you from this sitting position to raise your legs like that? Perfect, other side. All right, I'm just gonna ask you to move your leg, open it up, open the gate and close the gate, open the gate and close the gate. Perfect. Now I'm gonna ask you to flex your calf and stick your knee out, extend your knee. That, perfect. Same thing on the other side. Perfect. Okay, and then kind of like the hands, I'm gonna ask you to lift your feet up and then push down on that gas pedal. Give me some inward circles and give me some outward circles. Perfect. So it seems patient has full active range of motion bilaterally in all of his joints. Next, we are going to go to the neurological system. So, what were those 3 words I asked you to remember?
Shirt, flower, pencil.
Perfect. And then one more time, just for good luck, could you please give me your name?
David.
Perfect, Mr. David. And then, where did you go to high school at?
Arrowhead Christian Academy.
Perfect. I can actually confirm that detail. So it seems that my patient's remote, recent, and immediate, recent, and remote memory are intact. I'm gonna test the deep tendon reflexes real quick. All right. So normally you have a bicep reflex, you have a tricep reflex, you have a brachioradialis reflex, you have a patellar reflex, and you have an Achilles reflex. But for the purpose of this video, I'm only gonna do your patellar reflex. Make sure your feet are dangling off the ground. Perfect. All right. Ask you to just kind of look off into the sky. Perfect. I'm gonna go to the other side. Perfect. All right, we got a +2 bilaterally on that patellar reflex. All right, and then what else am I gonna do? Yeah, I'll do these now. I'm gonna now assess your cranial nerves, make sure that everything is kind of in order. First, I'm gonna test cranial nerve 1, which is your olfactory. So I have 2 scents right here. I'm gonna ask you to close your eyes. Can you plug your left nostril? All right, and what do you smell?
Coffee.
Perfect. And I'm gonna ask you to plug your right nostril. And what do you smell?
Lemon pepper.
That's what's up. All right, so cranial nerve 1 is intact. Next, we're gonna do cranial nerve 2. Could I ask you to stand up, sir? Ask you to come to this side of the room over here. Perfect. Now, I would like you to cover your right eye, and I would like you to read this top line in black.
Your 5 moments.
All right, could you cover the other eye, please? What does the line in orange say?
For hand hygiene.
All right, and now I'd like you to take both your hands away, and I'd like you to read what the whole thing says.
Your 5 moments for hand hygiene.
Perfect. Seems cranial nerve 2 is intact. You can sit back down, sir. Perfect. All right, so cranial nerve 2 is intact. Next, I'm going to test cranial nerves 3, 4, and 6 using these 6 cardinal fields of gaze. Guys, ask you to follow the tip of my finger with your hands. All right. All right, perfect. So cranial nerves 3, which is going to be ocular motor, cranial nerve 4, which is trochlear, and cranial nerve 6, which is abducens, is all intact. All right. Perfect. So now I'm going to test cranial nerve 5, which is the trigeminal nerve. All right, I'm going to use a hard and a soft side. Just for example, this is going to be what soft feels like, and this is going to be what hard feels like. Can you tell? Does that seem distinctable? All right, I ask you to close your eyes, please. All right, hard or soft?
Soft.
Perfect. How about now?
Hard.
Perfect. That.
Soft.
Perfect. Make our way to the other side.
Hard.
Perfect.
Hard. Hard.
Perfect. Cranial nerve 5 is intact. Next, we're going to go to cranial nerve 7, which is going to be vestibulocochlear. I'm going to go facial. No, it's facial nerve we want to do next, which is cranial nerve 7. I'm going to ask you to puff your cheeks out for me. That, perfect. Make an angry face. Squinch those eyebrows. Perfect. Okay, so it seems that cranial nerve 7 facial is intact. Next, we're going to go to cranial nerve 8, which is going to be vestibulocochlear. So what I'm going to do is I'm going to perform the whisper test. I'm just going to whisper 2 little things, and I would like you to repeat what they are. Mary.
Mary.
Perfect. Electricity.
Electricity.
Perfect. Cranial nerve 8 is intact. We can test cranial nerves 9 and 10 together by assessing the swallow reflex. I ask you to open your mouth and stick your tongue out, and then can you make a swallowing motion for me? Perfect. All right. I see the uvula rise and fall with phonation, and I also see his pharynx rise and fall with phonation. So cranial nerves 9 and 10 are intact, which is going to be glossopharyngeal and vagus. All right, now we're going to go to cranial nerve 11, which is abducens. I'm going to ask you to shrug your shoulders for me. Perfect. And then I'm going to ask you to turn your head left and right. All right. Perfect. Cranial nerve 11, abducens intact. Next, we're going to go to cranial nerve 12, which is hypoglossal. Can I ask you to stick your tongue out? I ask you to go left and right with your tongue like that. Perfect. I'm going to ask you to say the 3 following words: light, tight, and dynamite.
Light, tight, dynamite.
Perfect. So it seems that all 12 cranial nerves are intact. There's one last thing I went a little out of order that I would like to do is I'm going to test your abdominal section. So could I ask you to lay back down in the bed, sir? All right, perfect. I'm gonna lay you all the way down. Let me know if you feel any discomfort at any point. Perfect. So could I ask you to move your hands to the side? Perfect. So I just want to assess the abdomen at 2 different angles. Alright. Seems that your abdomen is flat. I don't see any redness, scarring noted, and hair distribution is normal. Next, I am going to ask you to bear down like the Valsalva maneuver. Perfect. I don't see any umbilical or inguinal hernias noted. Next, we are going to go and do some auscultation. I'm going to start with your right lower quadrant. We're going to go in a clockwise motion. I just want to hear some peristalsis. Oh, that's a nice one. Ooh. Nice. You got some normal active bowel sounds, alright, brother. Alright, and then I'm gonna use the bell of my stethoscope. We're gonna listen for any abdominal bruise. Perfect. No bruise noted on the abdominal. Last thing I'm gonna do is I'm just going to palpate the 4 quadrants of your abdomen. I want you to let me know if anything hurts, alright?
Okay.
Pain on that?
No.
There?
No.
Here? Patient on the ass this time.
Nope.
Perfect. Alright, so no tenderness or pain, no rigidity or I guess rebound tenderness noted with my client. Alright, last thing I'm gonna do is I'm just gonna make sure the bed is in the lowest position, get you back up to that. Tell me when you're in a comfortable position.
That's good.
Alright, just gonna side rails up. I know you're not a fall risk. Make sure your call light is within reach. Here you are. Is there anything else I can do for you, or do you have any other questions at this moment?
No.
Perfect. Alright, thank you very much, sir. Don't hesitate to call.